In January of 2019, my cousin passed away from a heroin overdose. Now, he had been struggling with this addiction for many years, going in and out of various rehabilitation centers. However, unfortunately, he was unable to overcome his addiction. In a class survey with 15 replies, 26.7% of students stated that they know of someone that struggles with an addiction, while 13.3% of students stated that they may know of someone that struggles with an addiction. That's 40% of students in the class that either know of someone or may know of someone that is currently struggling. Addiction Center reports that almost 21 million Americans have struggled with at least one addiction. These people are silently suffering, and the drug policy within the United States is not helping the problem. The current U.S. drug policy needs to be transformed, as it only provides legal punishment for drug activity rather than the rehabilitation of individuals. I'm going to be diving deeper into the U.S.'s current drug policy, other countries' drug policies, as well as the benefits of decriminalizing all drugs in order to reveal the faults in the U.S.'s current drug policy. Now, what exactly is the U.S. drug policy? From that same survey, 46.7% of students stated that they are not very familiar with the U.S. policy. On the White House's website, it details the Office of National Drug Control Policy, the ONDCP, as a component of the Executive Office of the President. Now, the ONDCP aims to control drug use by providing funding and coordinating law enforcement, community-based coalitions, as well as other actors on the ground that are helping to combat misuse. However, what happens when law enforcement finds an individual with an illegal substance? Well, while each state differs in charges for simple possession, American Addiction Center states that under a federal level, simple possession is a misdemeanor and can in fact result in up to a year in prison. Not only this, at the federal level, a fine for simple possession can be at least $1,000. People are still facing jail time for simple possession. These laws will not help individuals from using drugs. Instead of only providing legal punishment for drug offenses, the U.S. needs to focus on helping those with addictions. In other countries, however, they have succeeded in getting their drug abuse under control, and Portugal is a great example of this. Portugal is one of the countries that has revealed the impact of decriminalizing all drugs. Time describes the heroin epidemic that was rampant in the 1990s in Portugal, and during this time, 1% of all of Portugal's population was addicted to heroin. Not only this, but Time also reported Portugal as having the highest rate of HIV infection in the whole European Union. In response to this, Portugal became the first country to decriminalize all drugs in 2001. By 2016, the drug-induced death rate plummeted to 5 times lower than the European Union and stood at 1/15 of that of the United States. Its rate of HIV infection dropped from 104.2 new cases per million in 2000 to 4.2 new cases per million in 2015. New York Times describes Portugal's efforts as financial investments in harm reduction and treatment services, which have clearly proved to be successful. As demonstrated in Portugal, decriminalizing drugs will in turn help the drug issue occurring here in the United States. Drug decriminalization would eliminate criminal penalties associated with drug possession and drug use. Oregon actually became the first state in the United States to decriminalize all drugs. As reported by AP News, instead of going to trial or facing possible jail time for drug possession, a person now has the option to either pay a $100 fine or attend new addiction recovery centers. There are many benefits to decriminalizing drugs that go even beyond helping the person with the addiction. Drugpolicy.org explains that decriminalizing drugs would save money by reducing prison and jail costs, reduce the stigma associated with drug use, and most importantly, prioritize the health and safety over punishment for people that use drugs. Decriminalizing drugs in the U.S. will encourage addicts to seek help rather than be sent to jail for their addiction. Drug abuse affects many people within their lifetime. whether it be someone they know or even within themselves. The United Nations reported that the COVID-19 crisis and economic downturn that we are currently facing threatens to increase the drug dangers when our health and social systems have been brought to the brink and our societies are struggling to cope. I know that I myself have struggled immensely during these times, and with this virus, it's even more tempting for individuals to abuse drugs, as COVID has taken a major toll on many individuals' mental health. One thing is clear, however, that the U.S. needs to reform their drug policy, especially considering the times that we are currently living in. The U.S. needs to address this issue simply by decriminalizing all drugs. Changing the policy will encourage people to seek help and feel as though they have the power to overcome their addiction. Thank you.